Okay, we
So,
are now.
as a way of, yes, we're there now. So, as a way of introduction, prescription medications that fall along the categories or under the categories of controlled substances are the most closely regulated pharmaceuticals globally, right? Remember, we said prescription medications fall under three categories. We have prescription only medications, we have over the counter medications, and we have controlled substances. Now, of these three, any drug or medication that falls under controlled substances, like they are the most, like they are they are the highest, they are the most regulated pharmaceuticals in the world. Either anywhere you go in the world or even in Nigeria specifically, as long as it's within the system, any medicine that is called a controlled substance is the most regulated medicine. Okay. Now, these drugs are regulated because they pose two things. They have two dual functions in nature. They come with significant therapeutic benefits. At the same time, they have the highest potential for misuse, dependence, and addiction, right? So it's like a two, how you call that thing, a double-edged sword. They have dual nature. They possess significant, very important, or high therapeutic benefits. By therapeutic, I mean treatments, right? They respond to ailments, treatments generally. They have very high therapeutic benefits, but at the same time, on the flip side, they have the highest potential for misuse, dependence, or addiction. Hence, they require close monitoring and control. That is why they must be regulated. Okay? Hence, subsequently, right, for these particular controlled substances, from their manufacture, distribution, prescription, all the way to dispensing, they are governed by very strict legal and professional control. Like legal, when I mean legal, like kiri kiri legal. Like if you go against the principles, or you play around with controlled substances, you know, you could end up in court. You could end up being penalized. That is how serious controlled substances are. So in Nigeria, for example, know that there are regulatory agencies like NAFDAC, PCN, NDLEA, that possess the mandate to ensure that these substances are safe for use, but more importantly, they are not misused. Okay. Now, controlled substances, like I had mentioned, there are a number of them. They fall within different categories. There could be narcotics, stimulants, depressants, hallucinogens, and any other prescription drug that requires monitoring. I know that you're doing a bit of pharmacology. I'm hoping that some of these drugs will be mentioned to you, as well as their uses in other courses. So let's go to the next slide. Okay, so let's look at how controlled substances are classified. For the sake of this, we will not go too deep into the technicalities of controlled substances, but we'll look at the basic knowledge that you require to know about controlled substances. So one of it is how they are classified. Okay. Now, the global standard for the classification of controlled substances are in five. They're classified as schedules. They're called schedules from one to five. And the irony, right, with classification is that the lower the number, the more the stricter measures for control. Okay, so you have one, two, three, four, five. As you're going up, the level, the potential for abuse or misuse reduces. Okay, so the first one are the very high drugs, and hence they have the highest restriction or like regulatory measures being put in place. So we give you can take for example a few example of these drugs. So one example of a drug that falls within Schedule One is heroin, right? And these are stimulants. These are these are just hard drugs, and we know that once you take it, they have a way of messing around with your brain. Will actually lose it. Even of hard drugs like heroin. So they are the highest of controlled substances. They fall under Schedule A. Schedule 1, sorry. They have the highest tendency for abuse. They really do not have any medical use. But once you take them, it just knocks you off, and nobody wants to be at the extreme end of heroin. Maybe watching movies, or even within our neighborhood, people that abuse or take heroin, we see for ourselves how they are not necessarily productive to themselves, neither to the society. And in most cases, it ends fatal. Most cases, it ends with fatality. So we have the second schedule, which the tendency for abuse is high, but not as high as the first schedule. And there is restricted, like highly restricted. Examples of drugs that fall under that category: we have the morphine. you know these are very high, analgesic drugs, pain relieving drugs. We have oxycodone. Then you go to Schedule 3. So as you go all the way to Schedule 5, the tendency for abuse keeps on reducing, right? The medical use for some of this from 3 to 5, yeah, is acceptable. It means you can use them medically. For example, ketamine. These are drugs that are used for anesthesia, or either a short-term procedure in the lab. Just give you IV ketamine, and a very short procedure, surgery is carried out. In some instance, pain management, codeine, something that we've discussed about 5, that is diazepam, that antidepressants, tramadol. These are very, very high brands of pain drugs, which in no way should be used without prescription. Then, of course, we have the very low ones like low dose codeine that is used in syrups that we see all around Nigeria today. Our young people are just drinking codeine syrup, and to get high, and get wasted. So basically, these controlled substances are classified. You don't need to know too detailed. Just know that there are 5 different classification for controlled substances. The first one, being the most abused, highly abused, and as it goes down, the potential for abuse reduces. Okay, so let's go to the next slide. Thank you. So legal as attend classes, there is no way I make a presentation on a course and I don't talk about legal and the regulatory framework, because that is what pharmaceuticals are all about. It's serious business. They are drugs. They are chemicals. They are not water. They could be harmful, and so without works, without regulation, you just the tendency for it to be abused, misused, and could just be used for harm. Any pharmaceutical works within frameworks for accept standards on how you handle medicine. Same thing applies for controlled substances. We have governing bodies. For example, we have NAFDAC. Remember, I had mentioned NAFDAC, and I had said that NAFDAC is in charge of processes. So, right from importation, manufacture, distribution, basically, they oversee the supply chain, right? Ensuring quality assurance along, you know, the supply chain for pharmaceuticals. Then we have NDLEA. Now, NDLEA, I've never mentioned, National Drug Law Enforcement Agency. Names that are, or acronyms, are very familiar to all Nigerians. We hear them on the TV. We see the road when we're traveling with their crested vests, NDLEA. And what does NDLEA does? They are responsible for enforcement of drug control laws. They monitor politics, they prevent any form of diversion as well as abuse. Once God forbid, if an NDLE personnel catches you with drugs, I'm sure you've heard of their DG. A lot of questions to answer that could even lead to imprisonment in some instances, when found. So again, together with the PCN, these are bodies that all work together to ensure that there is control, to ensure that there is some sanity within the system. Product acts into them, but know that these are declarations that have been signed off by this level of governance in this country to support the control substances. Okay, these bodies and laws is mandatory for handling of controlled substances. So I think with that we can go to the next slide. Okay, so controlled substances, as a way of putting it differently again, are drug pharmacology said, but to know the basics, at least the adequate knowledge on what they are. They affect the nervous system, and that is why when you see even an adult excess of codeine, they start to act in erratically, right? They're beside themselves. It's like they're out of their senses. That's because this substance, they affect the brain gong direct, as well as the nervous system. So they effect that they have dual nature. One is for therapy harm, right? So some of these drugs actually help. They relieve pain when they're extreme pain, like for example, surgery, or a patient gets involved in an accident. Paracetamol is not going to help. You give paracetamol, the thing is not the pain substance. They're actually giving drugs like tramadol. It for extreme pain. They also calm anxiety. So in itself is a good thing. Some or some people actually have anxiety disorder. Some of them actually help down. And on the other flip side, they increase alertness, so some people, coding, there's so much energy, much, awareness and just energy, you know. But I said, while they have at the same time, they can help you get into trouble. The use of them could be administered. Like, for example, they can give you a feeling of false pleasure, or high, that makes people want to take on, get addicted, once people take those drugs. You need them, you want to have them. So once people get of addiction, that is when it becomes like very, very high risk. In some cases, people are taken to rehabs, they are locked. Is really a very sad situation when we find people that get addicted to guns. What substance is morphine, for example, is an opioid, right? It reduces pain, right, by attaching itself to certain spots in your brain. While this help with the pain, but it could also give you the sense of pleasure and reward that might cause people to use them. Beneficial effect, but their side effect is what other people go for them for. So they're not taking these things, the therapeutic effect, but the so-called odd effect that comes with the drug is what people are after. And it becomes risky. Benzodiazepines, for helps the brain relax. So if some of the nerves within your brains are stimulated or triggered, when you take benzodiazepine, it helps to calm the nerve. You feel calm. But increasingly, when you use it for too long a time, your body gets to it and it could lead to other symptoms, if not basic. These are what controlled substances are. They have both, like I had mentioned, therapeutic benefits. At the same time, they have abuse tendencies that could cause harm. So please don't forget, controlled substances have dual applications. So let me stop now. Let me see if anyone has any questions now, because I know I've been going for a while. Does anyone have any question or any clarification? Required any clarification? Yes, please.
Hello,
Yes,
madam.
Aris.
Yes.
Yes,
Where do you
yes.
classify drugs like ephedrine? What classes of drug are
Mm.
these? They can be also be made to be used for flu and catarrh, but because of the content of ephedrine, I wouldn't know where to classify them.
Okay. So you're correct. Ephedrine is used for flu, right? In when someone has some allergies or generally, but you just cannot walk into a pharmacy and they're controlled. Just let's put it simply. Drugs, a doctor will not, a pharmacist should not administer ephedrine, to any person that comes to a pharmacy without. So, what do people use them for? They're used to decongest the nasal cavity, right? Some people, in some instances, asthmatic patients, there are nasal congestions generally, you know. But like I said, they are not over the counter medicines because their tendency for abuse, and so you will classify them as controlled substances straight up. Yeah.
Okay,
Okay.
ma. Okay, ma.
Well done. Okay. So if there are no any other question, let me ask just a question, just to know if everybody is being carried along. Um, Precious, are you on the call? Precious, can you hear me?
Yes, ma, I can hear you.
All right. All right. Controlled substances have dual nature, true or false?
True.
Correct. That's nice. Okay, so can you explain what that means? You said true, so explain what that means.
It means that it can cause harm and it's also therapeutic.
Good. So it has both medicinal benefits, right? As well
Yes.
as it can cause harm. Brilliant. So it has dual nature. So let me ask the next person. Let me see those on the call. I want to make sure that at least we all pick one or two things. Ha! How are you? Are you on the call? Hello? Poker.
Hel- Hello, good evening, ma.
Evening. How are you?
I thank you, ma.
Okay. So let me ask you a question. You tell me it's a true or false question. Hmm? Um,
Yes.
Controlled substances.
I think you need to
Um,
reduce the mood.
have, please can you reduce your volume? I don't know your background. But can you hear me?
Ma, sorry, I'm at work. I don't have access to this thing. Yeah, I'm with you. I'm
Okay,
with you.
you're with me, Abby. Oh yeah, now.
Yes.
So, controlled substances, they are divided into, they have three different schedules. They have three schedules, true or false.
Yes.
Hmm?
Yes, yes.
Are you sure about that answer? So let me let me rephrase it again. You know, I had three different schedules. Like the one with
Yes.
from number one to three, the one that is the first one, they have more potential for abuse, like that. As you go down, it keeps reducing. So there are three schedules, true or false.
True.
Wupuka, you don't feel this one. No, who, who, who would help her? Somebody needs to bail her.
Rose, 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 Rose.
Rose,
Rose.
okay. Rose, yes, Rose, bail your friend.
Rose,
Wupuka.
get your
How
phone
many
out.
schedules do you have for controlled substances?
Hello, ma. Good evening.
Evening.
Ma, sorry, I
Have
didn't
you?
start at first. I'm just joining you guys. I'm at work.
Ah, you're going to have
Eh,
problems. Okay. So let me
sorry.
see who can help, who can build them out. How many schedules do we have for controlled substances?
It's three now.
No. Okay. It's like this is a
It's four.
difficult question.
It's
It's
five.
five. There are
It's
five
five.
of them.
Okay.
Yes.
Five.
There are
Okay.
five. Excellent. There are five different schedules.
Five.
Okay.
Yeah.
All right. So let me ask Rachel. Rachel was here quite early. Rachel, can you hear me?
200.
I
800.
can hear you,
Hello?
ma.
Rachel,
Hello?
if you're there, I I did mention NDLEA, right? Hello? Please, can you hear me? Can you unmute? Rachel,
Yes, I can hear you, ma.
okay, can hear me. So I did mention NDLEA. Can you meaning of NDLEA is, and what is, can you tell me NDLEA? What do they do?
Um, NDA, National Drug Law Enforcement Agency.
Mm-hmm. You're correct. You're very correct. So what do they do?
But did she say Nigeria or national?
She said National Drug Law
Okay,
Enforcement Agency.
okay,
Yes,
okay.
she's correct. So what did they do, Rose? Sorry, Rachel. What did they do?
They are in charge with eliminating the growing process of drug trafficking.
Drug trafficking, right? So they are charged with the mandate of eliminating drug trafficking. You've said it, and you're correct. So any form of drugs that is being trafficked, for it to be trafficked, it means it's illegal. And for it to be illegal, it means it's there are drug control laws that govern this kind of medication. So if it is illegal, it falls under the purview of NDLE. Very good try. Well done, Rachel. It meant you were listening to me. So, who haven't I asked a question? Aries, right? Let me ask Aries one question. Yes, let me ask Aries one question. So, control medicines or controlled substances, they have potential for misuse, dependence, and addiction. Yes or no? True or false?
True, man.
One. True. Okay. So give me one example, just one, apart from ephedrine. Give me one example of a controlled substance. I mentioned some a while ago.
Yes. There are so many of them. Like one I said,
Just
like
one.
I said codeine the other day. Also said
Mm-hmm.
um, um,
Okay, we had mentioned tramadol, we had
tramadol.
mentioned
Tramadol. I'm trying to get.
diazepam.
Yeah, we
Mm-hmm.
mentioned
Which
tramadol.
ones?
Yes,
Mm-hmm. Okay.
tramadol.
Uh-huh.
Yeah, we mentioned tramadol. Then
Uh-huh.
there are also other depressants that
Diazepam. Mm-hmm.
yes,
Antidepressant.
depressant. I'm trying to get and
Uh-huh.
we say
Correct.
codeine.
You're very correct. Yes, codeine, you're correct. Yeah,
Yes.
these are all controlled substances. You're very
And,
correct.
and, and lately, there are things that these days, these days you don't just go to party and start eating cake and stuff like that because there are these days it's so dangerous to eat even where they are doing birthdays, especially with the young people because you don't know what could be added to the cakes and cookies and all that. I don't know what they call those stuff.
Iris, how do you know that one?
Yes,
Tell
it's
me,
all over
how do you know that?
it's all over the news. It's all over the
Hmm?
news. Yes, it's all over
So
the
it's
news.
it's you're hearing
Can you hear me, man?
this. Okay. So it's not from experience, Abby. It's because you're
No,
hearing it from
no.
news.
Because the other day, I actually I live in Lagos, but I heard that some people were arrested in Abuja. They cause some people that are making cookies and they even go to the extent of selling to kids in school and stuff like that. So I don't know what they call
True.
them, but
Like,
it's dangerous.
mhm. you know, it's just we're living in very, very difficult times. The situations that we find ourselves is just I just think that even as adults, let alone for children, we cannot be over careful with our environment of today. There's just so much vices out there, and people keep trying to beat the system. People keep trying to find ways of selling and all these hard control substances, even to young people. And you're correct. It's on the news. Cakes, drinks, different things that are being used, to conceal these drugs and are being ingested. I really pray that we stay safe, and for those of us that have
Amen.
families, we can talk to our children as much as we can to keep away from such vices. So you're very correct, Iris. Okay,
Thank
so
you.
everybody has passed for today, so we can go to the next slide then. Thank you. No, I haven't asked Stephanie. No, one more person. Dr. Stephanie, you have to say something. Let me ask you a question. What do I ask you now?
My just carry it over to another class because I went to make dinner for spouse. I walked in while you were asking questions. So allow me to read the note and ask me anything next time.
Next time, Abby. All right, we'll
Yes,
try
ma,
it
please.
next week.
Thank you.
I just want to make sure
Thank
that
you.
people are on the class and are listening to what I'm
Yes,
saying.
ma.
You know,
I
I
get
will.
it.
Oh, I'll
I
ask
stay
you. Okay.
I stay dedicated. Don't worry, ma.
All right. So let's go to the next slide
Thank you.
then. All right. So let's go to the next slide. Okay. So controlled substances, how they are prescribed. And so, because again, these are drugs that, not many people have access to even dispense it, even within, the pharmacy setting. It's not everyone, that has access to these drugs. You find that in very, very large hospitals, you actually have, maybe in very large hospitals where you have like three, four, five pharmacists in a pharmacy. I can assure you that within them, there will be only one dedicated person that will be assigned to control drugs. Like that is how restricted it is. There will be five pharmacists in a pharmacy, but only one will have access to those controlled drugs. That is the height of minimizing access and trying to regulate, the flow of these substances. Again, just like any medicine or drugs, controlled substances are not any different. There has to be a valid prescription. Pharmacy technician, you everything about you starts and ends with a valid prescription. So every drug, either you're compounding, you're dispensing, whatever it is, there has to be a valid prescription. And I know we've spoken a lot about why we need, a valid prescription. So let me ask each and every one of us, tell me one thing that will make a prescription valid. So I come to you, I say, here is my prescription. I hand you over a prescription. As a pharmacist, qualified pharmacist technician that you are, tell me one thing that you look out for on a prescription for it to be valid. So let's start with Aris.
Doctor's prescription, like doctor's signature or something. There must be a prescription for it.
Excellent, correct. There has to be the prescriber's name, or a
Yes.
signature or a number. Yes, that is very, very correct, Aris. You have one mark. Thank you.
Thank you,
So
man.
who's the
Thank you,
next
man.
person? Hinwe Poker. Okay. Tell me the one. Tell me another thing. She's laughing. I don't know. I'm always struggling with your name. So tell me one
Sorry.
thing that you would look out for a prescription to be valid.
Date.
Date.
Yeah.
Something as fundamental as dates. Go girl. I mean, like there's no date that prescription will not even be attended to. Okay, like you got that right. Well done. Date of issue. Now, beyond just the date, right? It has to also show like a validity period. So, for example, today is what's today? Today is 12th of October,
Yes,
right?
yes,
2020.
yes, man.
Okay. So if the farmer, like for example, let's say diazepam, the patient is meant to take it 25 milligram once a day for 3 days. You see that 3/7. You know that ends the date, right? You know when this drug is supposed to finish. So it's called the validity period. It means it should not exceed the 15th of October. So because the control substance, these are fundamental dates that would have to be seen on the prescription. Well done. So who is next? Tell me another thing you would look out for in a valid prescription. Precious.
The patient information and the dosage.
I hope you can hear my me clapping for you.
Yes.
Yes, good. Very good. So patient information, full name, you gave me two. And dosage, excellent. Excellent, you're correct. The critical thing that, apart from the about the patient's information, the name, the age is also very, very important. The age is important. Now, because don't forget, these are controlled substances. Because they are controlled substances, you would go a bit further. So for paracetamol, for example, over the counter, you put your paracetamol, take 2, 3 times a day. Maybe you put a name, age, and that does it. But for controlled substance, because you will put address, like it is that serious. You would put address. The prescription must carry an address, which you would translate into your register for traceability. In case something goes wrong, it easily can be traced up until as far as the person's address. It's that important. Okay, so what other thing do you look out for? What other thing do we look out for in a prescription? Rachel, tell me one, the last one.
Maybe drug details.
The what?
Drug details, the quantity prescribed, the strength, and all that.
The drug details, right? Like the name of the drug, the strength of the drug. So it's diazepam, 25 milligram, taking once for 3 days. That is the drug regimen, right? That's what it's called. You're very, very correct. Now, all of us are correct. These are all the components of what makes a valid prescription for controlled substances. Honestly, I'm so proud of all of you. It means you've been listening. Thank you. Okay, so we might want to stop here for today. Again, the idea is so that we go back and internalize all that we've said, and then we can come back next week to wrap up on this. Now, for example, if you're doing a pharmacy program, a degree program, or even a master's on these topics, these are topics that it to take close to a month of you're running this course, about a month or even more, to talk about the in-depth of this. So what we're giving you right now is basically like the basics, what they need to know when it comes to controlled substances. So I would stop now. In way Poker, your hand is up. Do you have a contribution? Do you want to contribute something? In way Poker. Hello? Your hand is up.
Ma, sorry, it was the previous one. It was the previous
Aha.
one. Sorry.
It's no, you're fine. Okay. So like I said, we're going to stop here for today. Then we can continue next week. Please, 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 please remember all that I've said. Key takeaway from today's lecture is the fact that controlled substances or controlled medicines have both therapeutic, and as well as they have tendencies or potential for misuse, dependence, as well as addiction. Controlled substances, are regulated and have strict legal and as well as professional controls surrounding them, which we've mentioned some of them. I said they are classified into 5 schedules, schedule 1 to up to 5. We gave examples of, some controlled substances that have both beneficial as well as harmful effect if misused. We we spoke about prescription, what a typical prescription requirement should be, and we all gave very, very, very important and valid points. So I think with that, we will stop for today so that you can all rest, the rest of the time. Next tomorrow, it's a Monday.
Can I
Um,
ask you just one question, please, man?
yes, please.
Yeah, this the like club drugs. The drugs that are used in
Oh,
clubs, most clubs. Where do you classify
like,
them?
like which one?
There are so many clubs like MDMA. All those are they are they OTC drugs?
No, no, no. Now, yeah. Now, Iris, let's talk about this. So, what's an OTC drug?
Over the counter drugs.
That means when you enter a pharmacy, Abby, just say, I
Yes,
beg, give me paracetamol. That's an over the counter drug. Abby, I
yes,
beg, give me
yes, madam.
flagyl. That's give me that's over the counter drug. For
Yes.
these club drugs that you call them, do you enter any pharmacy or anywhere and say, I beg, give me club drug as you call them, and it is handed over to you? No.
The practice over here is different from the practice over there in other clime. Yeah, I'm just trying to find out because over here we abuse a lot-
No.
we abuse the privilege of the system is not straightforward or something.
So they are not at all. They are not over the counter drugs. They are hard drugs. They are controlled substances, right?
Okay, okay.
They are, yes, no, 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 at all. They are very, very controlled substances. Now you know that some of these drugs, these hard drugs, they are active ingredients. I know in compounding, I had heard the active ingredients being mentioned. You know, some of these drugs, these hard drugs, are actually active ingredients that are used, that are mixed, again, for medical purposes. But over time, a lot of these active ingredients are taken, they are construed or constituted differently, right, in a way that will
Okay.
cause harm. Yes, they are constituted differently in a way that will cause harm. So clear, no, they are not over the counter drugs. They're not even prescription medicines at all. They are hard
Oh,
drugs. They are controlled substances, and should not be found easily, or access at all should not be found. And that is why it's coded. It's coded. I don't go to clubs, but I assume that even within the club, you will not be saying, take, oh, we're selling. I'm sure it's coded. It's not out in the open. It's within a particular circle, correct? You have to have information to be able to access it. So again, and it's because it's illegal. So, there's just so many things around it. It's illegal drugs, illicit drugs. It's against the law, to take those drugs or those substances, the way they are being handled in this country. So, sir, straight to your question, they are controlled drugs, they are hard
okay,
drugs.
man. Okay,
Yeah,
man.
yeah.
Thank you, man.
Well done, sir. I love your questions. Okay.
Thank you. Thank you, man.
Okay, so brilliant. If there are no any other questions or any additional contribution, I'll allow all of us to rest, and we'll see you on Friday. Take care.
By the grace of God. Thank you,
By
man.
the grace of God. Thank you, Aris. Bye.